next exercise is specifically for facilitating the diaphragm. So if you are practicing the diaphragmatic breathing and you notice maybe one side of the abdomen was a little bit harder to fill, it was maybe lacking a little bit, you couldn't get it to expand as well, this next exercise is going to help make sure that both sides of the diaphragm are working just as effectively. And this is really important because your diaphragm also plays a huge role in core stability and maintaining pressure in the system in order for you to be able to support your spine during movements. So breathing has a huge role in not just getting oxygen in and out, but also allowing us to move with efficiency. So this next one I'll demonstrate. You are going to start again laying down with the knees up, and then you're going to take a few normal breaths, and then as you do that, you're going to sink in just inside this hip bone with your hands, and you're going to slide just along the pelvis and begin to compress the abdominal contents into the diaphragm in a diagonal pattern. You'll slowly sink in, gently feel that resistance against the diaphragm, and then you're going to practice a diaphragmatic breath, breathing into those hands, trying to push those hands out of the abdomen. And you'll slowly exhale, and you'll practice that a few times, just pushing out at the hands. And after practicing that about 3 times, take a few normal breaths and get yourself nice and relaxed. And then the next time you practice this deep breath, deep diaphragmatic breath, you're going to inhale, press the hands out, and then holding that pressure against the hands, you're going to try to exhale while maintaining that pressure against the hands here. And you'll do that about 3 times, trying to keep that pressure into the hands, and then go ahead and exhale. Completely relax the diaphragm, relax the abdomen, and then go ahead and try it on the other side. See which one seems a little harder, and if one does, that's what you're going to be practicing. And this is going in a diagonal pattern. So when you're resisting, say, the left side with your hands into the pelvis, compressing the viscera gently against the diaphragm, you're going to be using the right diaphragm to try to push those hands out as you breathe in and keep them out as you exhale. So that is a diagonal pattern of the diaphragm, self-resisted, that you can practice at home and use it as a little bit of an assessment as well to see if one side of your diaphragm might be a little more efficient than the other.